All right, so anyway, why do I want you to at least be able to recognize the numbers? You don't need to know what the name of the gene is or what it does, but you do need to recognize which numbers are in here. If I say 13, you've got to know it's not got a 13. So it's 15, 14, 15, 17, 18, 19, 24, 25, 27, 31, 41, 51, 55, 66, 110, 120, and 160. Why? Because when you go and get a HIV test, they're going to run an ELISA on you, whether it's an ELISA on a stick, like the one where you have the little lollipop, or whether it's not now one where they take blood. But they're going to run an ELISA on you. And remember, there is no test that is 100% perfect. So there is, if this is the ELISA test, and this is so if this is the borderline that separates positives from negatives, what do you do with the top 10% of the positives? Are they people that are in what they call the window, that are seroconverting over a 90-day period to being positive, or is there something else involved? And so when they run the ELISA test, they run it, and if you're positive, you go to the next test. If you're borderline, you go to the next test. So what's the next test? Another ELISA. So they do another ELISA. If it's positive, you go to the third test. If it's borderline, you go to the third test. If it's negative, you don't go any further. So if it's negative on the first test, that's it. If it's negative on the second test, that's it. But if it's borderline, then you go to the third test. So if anybody is positive, they will have had 2 ELISAs. And those ELISAs will either be positive or borderline. All right, what's the next test? It's called Western blot. And Jane Getchell is the one that devised it. And it is basically an ELISA on a strip of paper. We take the virus and we put it in a little container, a plastic container, like this, and we float inside a strip of white paper. And we put saline in there, and we put whole HIV that we've harvested and grown, and then we put detergent. Now the detergent explodes HIV into the individual proteins, but you can't see anything. Then we put it on a charge overnight. Put a positive up here and a negative up here, and put it on a rocker overnight. The proteins of the virus line up. The lighter ones move toward the positive end, and the heavy ones stay. Actually, it's the opposite. The heavy ones stay here, and the lighter ones migrate. All right. And so they line up on a strip of paper according to their molecular weight. The next day, we add patient serum. What do you think else? Horseradish peroxidase. And if you have antibodies to any of the proteins of HIV, a black line will show up. So we are checking to see if you have, these are the proteins that make up the virus. And the P stands for protein molecular weight, 24,000 molecular weight units. And GP stands for glycoprotein or envelope protein. And so when your body comes across the virus, the first thing it sees is the envelope. So that's the first antibodies that are made. They're in light blue. So you can tell how long someone's been positive by what bands they have. If they have a glycoprotein bands, it's only been a few weeks that they've been positive. Now, what happens next? Here's the virus setting in your blood and your body is attacking it. Most people think the body's not doing anything. It's constantly attacking it with everything it has. And so first it makes antibodies against the outer envelope, and then it rips it open, and the next thing that's seen is the core. The protein around the genome is called the core. So the second set of antibodies that are made are against the core protein, and then it makes it against the other proteins. So first is the blue, then comes the yellow, then comes the orange, and finally the last is going to be the green. So your body makes antibodies to each one of the proteins, and which antibodies it makes tells you how long the person's been infected. Now, there was one problem. I don't know if you remember, but a few years ago when they first came out with a test, they made it mandatory for people in the military. Everybody in the military has to be tested every 6 months for HIV. It's not because they want to control HIV in the military. It's because they wanted hundreds of thousands of tests to see how well it worked on the general population. And you sign away your rights when you become in the Army. You have no rights, so they can order you to do anything. So what they discovered after testing hundreds of thousands of people was that there was a Asian flu that had a P18 or a P24, and some women that are pregnant have a P55. How did they discover that? Because after they tested everybody in the military the first year, they had a bunch of Top Gun pilots in San Diego for the Navy. 17 had borderline ELISAs twice and a P18. And there was no way. They went down and investigated. They weren't shooting up. They weren't out hoochie-cooching around or anything. They were married men, and there was no way. Their wives were not positive. There was no way they could have gotten HIV. So whenever you don't have anything you can explain, what do you do in your computer when you can't get anything to work? What's the number one rule? You should know. Reboot. That's right. And that's exactly what they did. They left them alone for 3 months and went back, and the band disappeared. So then they went into their medical records and found every one of them had the Asian flu. Then they went and got the Asian flu and found it had a P18 or P24. So then they found a few women that had a P55, and every one of them was pregnant. And after they had the baby, they were no longer had a P20 or P55. So they instituted the rule that to be considered infected with HIV, you have to have 2 positive ELISAs and a Western blot with 3 bands. So remember, you've got to have 3 bands. What if you have 1? You're said to be indeterminate in the window, come back for retesting in 3 to 6 months. Either it will go away or you will seroconvert. But they don't tell you either it'll go away or you'll seroconvert. They'll just tell you you're indeterminate. They're not going to scare the hell out of you. But that's good enough to scare you. If you have 1 band or 2 bands. If you have 3, you're HIV antibody positive, Western blot confirmed. Okay, so we're going to go on till 9 here. So let's move on, and this is probably the most important thing in the whole lecture on HIV, and that is the AIDS timeline. What is the AIDS timeline? I'm going to turn down the lights so that we can see a little bit better. The AIDS timeline assumes things. There's always assumptions, and the assumption is this. This person is a white, straight man that got infected with HIV by sex and did nothing. What would happen to them? Remember, the only people that count are white, straight men. All right, so if this is a white, straight man, what would happen to him? That's the AIDS timeline. So we start over here at time point 1, 0 time point, event number 1. And this is the day of the dirty deed. How did he get infected? Sex. All right. So he had unprotected sex and he got infected. What happened? Within 10 to 14 days, we have what we call event number 2. It's at 2 weeks, and it's called the HIV flu. This coincides with the first replication. In other words, the T cells got infected and they're suddenly exploding 10 to 14 days afterward. And your body is first time seeing this huge ejection of foreign protein. So it reacts with a flu-like syndrome that'll only last a few days. Now, if one of you come in, sweaty and fake, I don't go, I gotta get away from her, she's got the HIV flu. You can't tell one flu from another. It's a flu-like syndrome. Low-grade fever, body aches, sneezy, feel icky. It only lasts about 4 to 5 days, and then it's over, and you never have it again, and it coincides with the first replication. How do we know about it if every flu is like any other? Retroactive investigation. Lots of people know when they turn positive. Remember Magic Johnson? He knows exactly when he turned positive. Why? He had a blood test for life insurance. He was negative. He went and did whatever he does, and then he came back, and he and his wife were going to have a new baby, and they decided to increase their life insurance. So he went and he got a new life insurance policy, and they required a blood test, and he was positive. So he can go right back and say, okay, within the last 90 days, what did you do that might have infected you? And people will go, oh yeah, that girl with the red high heels. You know? And then 2 weeks after that, did you, like 10 days to 2 weeks, did you have a flu? Yeah. That's how they do it. Retroactive investigation.
Is HIV-1 and HIV-2 progressive?
We don't know. We think HIV-2 progresses slower, but just very little. Okay, so that's event number 2. Event number 3 is from the day you got it to the day you show the first general symptoms. And look how long it is. It's 5 to 10 to 15 years. Now, why as short as 5? There are some people, once they find out they're positive, they give up on life. I had a next door neighbor, one of the nicest people I ever knew. And he was an insurance adjuster, and he made money hand over fist. He was cute, he was nice, he was a good person. And for some stupid reason that no one knows, he got drunk and got infected. And as soon as he got his test results, he quit his job. He went in his apartment, he never came out. He drank bottle after bottle of vodka, ate pizza, and died within 5 years. Because every time you talk to him, I'm going to die of HIV, I got HIV, my life is over, why live? You know, you can drive yourself to death. But people that take good care of themselves and you know, eat right, exercise all right, they may never know they have it for 10 to 15 years. In this area where you have no symptoms except for a positive blood test, it's called HIV disease. And there is nothing that would tell you you're any different than anyone else except getting an HIV blood test. Now, the time period when you do the dirty deed to when the test really turns positive is 90 days, and that's called the window. And that's the most dangerous time. Why? You are positive, you can infect other people, but there is nothing that will tell you you're positive except for a blood test. So people have been known, like you could have sex with people and give it to them. You could donate blood and it will test negative, and you will be infecting people. You can get killed on the freeway. There was a Marine killed on the freeway. He'd been ho-hoing around. He got HIV. He had in his wallet, donate all my organs. They tested his blood. It was negative, but it was really positive because it hadn't been 90 days. And everyone that got his organs got HIV except for the person that got the bone marrow because they treated it. So remember, the window is the dangerous one. Why? You are positive, but no cheap, easy test will test for it, will show it. Even if you spend the $1,500 PCR test, it still can't tell before 9 days. Nothing known to man will show that you're positive in the first 9 days. You can spend $1,500 on day 10 to find out, or you can wait day 90. Now, I got stuck by a needle. I didn't know if it was contaminated or not. Let's put it this way. Every Friday we went out drinking with the other people at the CDC and the AIDS branch to have beers and eat at TGI Fridays kind of place. And I was late. And I've been doing experiments all day long. So I bagged up all my stuff and I put it in the autoclave and it wouldn't fit. So I pushed the autoclave bag in my spacesuit with my gloves on, and I passed through her pipette, came through, I still got the scar, where it went right into my palm. And oh my God. And of course, when you're working with experiments, you label everything in your experiment with the experiment number. So I rip it open, I pull the pipette out, I look at the number, I go over to my lab record book, I flip through there, and it says 10,000 concentrated HIV. Now that's just the experiment, it doesn't mean the Pasteur pipette, but I didn't know that. So I'm going, oh my God, is there an axe? Can I cut my arm off? And then I thought, God, it's already circulated by now. I'm going, what do I do? And I went over there and we just done the non-oxal 9 experiments. I knew non-oxal 9 killed it, so I got a whole bunch of it and tried to push it in there. Doing like this, and shaking it and all that. Meanwhile, I'm crying hysterically. You know, oh God. And I go and I look over the edge. I'm on the 7th floor of the virology building. If I jump, will I be dead when I hit? Or will I just be paralyzed for life with AIDS? You know, I'm going, oh shit. I'm getting more hysterical by the moment. And finally I call the doctor on call. And I call the doctor on call and he says, I can't understand you. Can you stop sobbing? And I said, I think I may have contaminated myself. And he said, come down to my office and tell me what went on. So I go down to his office and I tell him, and he looks at it and he says, And then he says, I'll tell you what, we're going to give you the HIV P24 direct antigen test. And this test, if you've got a huge dose, will tell you if you've got a huge dose. Now, I knew that test was crap. You know, the only time it ever is positive is over here near death, when you have gazillions of particles. Or when you're doing, you know, a culture, cell culture. But it only costs 25 cents and it takes 30 minutes to run. And somehow I wanted him to run it. And so, and he says, listen, we'll just run it. And he comes back, congratulations, it's negative. Now, I knew it was a shit test. He knew it was a shit test. But then it allowed him to say, well, we don't have anything better, so you're going to have to come back at 30 days and 60 days and 90 days. And if after 90 days it's still negative, you can be 96% sure it's what it says it is. Of course, you really have to be tested again at 6 months to be sure. But that P24 enabled me to make it through. And come to find out, it must have just had saline in it because I never got infected. But the important thing is to remember that you have to wait the whole 90 days to get the test unless you're willing to pay for the PCR, which is $1,500, and insurance won't pay for it. Because it's only approved to test to see if somebody's viral load is low, not to see if they got infected. So remember, the window is the most dangerous. You are positive if you got infected after about the 7th day, you infectious to others. So the asymptomatic period is from the day you get infected to when you first show a general symptom that can be attributed to this disease. You are infectious from about the 2nd day to the day you die, if left untreated, of course. All right, so what is this right here? ARP. This is age-related complex, and if you go to any medical doctor, the medical doctor will tell you there are 2 stages of this disease: asymptomatic and symptomatic, or HIV disease and AIDS. But if you go to the government says, no. There's HIV disease, we agree on that. But there's 2 other stages. There's AIDS-related complex and full-blown or frank AIDS. The reason for that, as I told you before, is prior to Obamacare, you have no right to insurance in the United States. And as a result, there is a catastrophic medical rider in the government laws that say that if you get a catastrophic illness and you have lost everything, you lost your house, you lost everything, they will help you. But they reserve the rights to set the date that they begin. And so, since it is so expensive to treat people when they're in AIDS, they say that when you're in AIDS with just general symptoms and not specific ones, the government won't help you. Well, that really doesn't matter in a civilized part of America. In other words, every big city, the East Coast, the North, the West, Florida, and even Louisiana have state agencies that will help you the moment you get general symptoms. They will provide you, there is an AIDS HMO or a state agency that will give you Medi-Cal or that sort of thing. So, but places like Alabama and Texas, if you have no insurance, they will only give you what the federal government allows, and that's when you're in the last stage and you have 2 years left. And that's all about money. So remember, there's an artificially created designation called AIDS-related complex. Medically speaking, there are only 2 stages to this disease, HIV disease and AIDS. The government puts this artificial category of, I guess, early AIDS or weak AIDS or something like that. It's called AIDS-related complex. So when do you fall into general symptoms? And it's when you have about 500 T cells. It's when these general symptoms that you could not attribute to any one disease, but if you get several of them at once, you know something's wrong. What are the general symptoms? Recurrent diarrhea. When I get diarrhea, I know why I've got diarrhea. I ate the 3-week-old pizza that was in my refrigerator. You know, single men live like that. We order gigantic and we eat half, and we don't want to waste it, so we put it in the fridge, and then 4 days later we eat it. I know when I get diarrhea when I get it. We're talking about you eat normally, things that are not suspicious, and you get 4 days of just horrible runny diarrhea. Or you have cuts that don't heal. Normally when you're shaving, you cut yourself, within 3 days it's healed. 3 weeks later, it's the same as the day you cut it. So it's cuts that don't heal, recurrent diarrhea. In women, it's recurrent yeast infections, one right after the other. You get one cured and another one happens. Night sweats, where we're not talking about, oh, I feel a little damp. We're talking about you could wring a glass of water out of your pillow. You sweat and roll and tumble all night long. The next morning you wake up, you don't have a fever, but the bed linens are soaked. That is night sweats. They come and go. Another one, rashes of undetermined origin. Trust me, when I get a rash, I know why I got the rash. I use the Tide detergent with spring smell in it, or I ate a green mango. There are only 2 things that give me a rash, and I know every time I like them, so I eat them, and I get the rash. These are rashes of undetermined origin. There's no way you could figure out what they came from. So all of these are called general symptoms, and they are not attributable to any particular illness. Everybody gets flu-like symptoms. Oh, I love the one of them. One of them's called general malaise. I feel like sick. I have that every Monday morning. All right? But anyway, if you got one of these, I would not be worried. If you got 2, I'd be a little bit concerned. But if you have several of these at once, you're going to know something's wrong. And that's when people first go get tested, when they have these general symptoms. And when does it occur? About 500, or but they've lost about half their immune system. Remember, your T-cell count stays up. Your body continues to fight, and it doesn't begin declining until about the 8th year. And then it suddenly declines, and when it crosses 500, is when the viral load is shooting straight up. So when those two cross is when you first start getting the general symptoms. What else? Is there anything else on this? Don't think there's anything else. Anyone have any question on it? AIDS timeline? Okay. Move just a little bit further. CDC has their own timeline. If you go to get a diagnosis, they're going to tell you you're group 1, group 2, group 3, or group 4. It more or less matches. This is when you first get diagnosed and you have absolutely nothing. This is you have the flu-like symptoms. There are no positive blood tests. This is when you have a positive blood test, but there are no complications. This is when they start getting the general symptoms, and this is when you're in stage. So, if they tell you you're group 3, I begin to worry. All right. This picture right here is the official diagnosis of AIDS, and it's very complicated, so listen carefully, and this will probably be the last thing we do tonight, because I'm getting tired. But it's this. What's the difference between official diagnosis of HIV infection and AIDS? Infection means you've got the virus that causes the end-stage disease, AIDS. Now, what's official AIDS? Official AIDS has a very complicated definition, and that is you've got to have one of the 21 opportunistic infections listed on this page and HIV antibody positive Western blot confirmed. So legally, according to the insurance company, according to the government, according to the state, to be classified as having AIDS, you have to have one of the 21 diseases, have had at least once. You may have recovered from it, but you have to have one of these 21 diseases, and you have to have the HIV antibody positive Western blot confirmed. Now, there's an or. There is another one. Because so many people, particularly women, died without ever having one of these opportunistic infections and were not legally declared AIDS. Remember, you go to the federal government and ask them how many people have died of AIDS in the United States, they will say 250 to 500,000. You go to APLA and ask them, they will say 1.2 million. Why? The government doesn't count anybody that died in ARC. If you died in ARC, you didn't die of AIDS. And women die in ARC. So, they changed the diagnosis to this. And it can be either one. Instead of having one of 20 of the 21 opportunistic diseases, you have to have an HIV antibody Western blot confirmed blood test, but if you have 200 or less T cells, can also be called full-blown or official AIDS. Now there's a problem with that. What if you have 199? Then you didn't die of AIDS, even though you did. So that's why the numbers are so radically different between what the government says and what the doctors say. Because if you're HIV antibody positive Western blot confirmed and you die because your immune system doesn't work, the medical doctors say you die of AIDS. The government said, how many T cells did they have? 200 and... No? Well, if they had 201, they didn't die of AIDS. If they had 199, they did. So it's a way to not scare people. It's not as bad as you think it is. Because they didn't really die of AIDS. So it's kind of tricky. All right, let's see if there's anything else. These are the diseases. So that takes us to the causes. Do you want to go a few more minutes or not?
Yes.
Let's just go a little bit longer. Just a little. I promise 9:15 I will be in my car driving home. All right, so remember, big mistake was giving this name grid, and then to keep people calm, it did just the opposite. U.S. government said, don't worry about this disease. The only people that get it are people in the following risk groups: homosexuals, prostitutes, IV drug users, and Haitians. Don't you love it? An entire country was a risk group. The funniest cartoon I ever saw that was sad funny was one from the New York Times, and it has this rich couple in Fifth Avenue in their super ritzy apartment, and the man looks at the woman and says, "Dear, did you know that the Joneses' son has AIDS?" And she looks up and said, "I didn't know they were Haitian." So the problem was listing risk groups. It's not risk groups, it's risk behaviors. Not all homosexuals are in any risk group. Not all IV drug users, not all people that are prostitutes are in a risk group. It's their behaviors. And so the big problem was they didn't distinguish behaviors from groups of people, which allowed prejudice. So anyway, how do people get it? And these are listed in order of their danger. So number one, if you get transplanted, or remember, blood's an organ, so if you get transfused, that's a transplant. If you get transplanted with any organ from an HIV positive person, you will be 100% positive. Next, needle sticks and needle sharing, that's tricky. If you get in a hospital a needle stick from a positive person that has an uncontrolled viral load and the needle is dry, your chance is only 1.2%. If, however, you share a wet needle with somebody that has coated the entire interior of the syringe with their own blood, and then you use it, your chances are extremely high, up in the 80%. So it depends on the condition of the syringe or the needle, and it depends on the viral load of the person. Now here's the really rotten thing about it. You have no right to know the HIV status of a person who has accidentally stuck you with their needle. In other words, you're going in and you're treating a patient and you accidentally needle stick yourself with a needle you used on them. You have no legal right to know whether they're positive or not, and if so, what their viral load is. But you'd be an idiot not to check the chart that's sitting right there. But I have known people at testing centers to get needles stuck and then not be able to find out what the result of the patient was. And if that happens, in Europe, they put you on the 3-drug cocktail. And here in this country, in a hospital, they'll put you on the 3-drug cocktail and they'll pay for it for 3 to 6 months. But they don't have to. All right, the next one is sex. And remember, sex has to do with circumcision. One of the things we discovered in studying people in Africa was in Nigeria, on one side of a valley, they were all Christian kids, and on the other side, they were all Muslim. And the Christian kids were not circumcised, and the Muslim kids were. And they couldn't figure out why the Christian kids got so much more HIV, the Christian boys did, than the Muslim boys. And what they found out was it had to do with circumcision. It's about the cell that HIV loves to infect. Its #1 most favorite cell to infect is a Langerhans cell. And Langerhans cells are found in 2 places on the human body: around the cervix and around the foreskin, just inside the foreskin. That's why women are so easily infected, because those are Langerhans cells around the cervix. And HIV is like designed to infect those cells. And so if you remove the foreskin, the Langerhans cells die and they don't seem to perform a function. And so men that are circumcised are 25% less likely to pick it up than men that are uncircumcised. So that is, and one of the questions that comes in now is, that I ask about this is, what is the number one cheapest way to slow the spread of AIDS in the world? And it is male circumcision. And that's what they're doing all over Africa now. They're circumcising the boy babies because that's a way to reduce the spread of this disease. All right, now let's talk about prostitutes. I know people love to blame prostitutes. The problem is, prostitutes have not been significant in the spread of this disease. Prostitutes that maybe have HIV that's uncontrolled, perhaps, but prostitution is not a significant spreader of this disease. In a normal American town, there's not many prostitutes. And I know that what's his name, what was Hugh Grant, you get to show over there at the 7-Eleven at Fairfax there. But in the United States now, if you get arrested for prostitution, particularly in California, they force test you. And if you're positive, you are warned by the judge when you go before the judge that you have been force tested and you have been legally notified that you are positive. And if you are ever arrested again, it is 6 years in jail. So let's kind of knock down that a little bit. So prostitution in most countries is not much of a transmitter of this. It's everyday boy-girl sex. And the one most dangerous position to get in is anal receptive sex, because it's not virus floating around in semen that's dangerous. It's infected white blood cells that can squeeze between other cells called diapedesis, and at any moment that infected white blood cell can explode, releasing millions of particles. So remember, it's not HIV floating in semen that's dangerous. It's the infected white blood cells that are in semen. They're also in vaginal secretions. But remember, why is anal sex so dangerous? Because there's only one cell between the anus and the blood system. In the vagina, there's 3 to 5 cell thicknesses before you get to capillaries. And since white blood cells can squeeze, they don't need a hole. It's much more dangerous to have anal sex. And we talked about the Bowley discovery, Bowler and Bowley, about many more people are using anal sex than anyone discovered. Vaginal sex, all right, it's much, and it's logical, we've just mentioned it, it's much more dangerous for a woman to have sex with an infected man than it is for an infected man to have it for an uninfected man to have sex with an infected woman. The reason for that is a woman is 35 times more likely to pick it up from a man than a man is to pick it up from a woman. Why? Volume. Think about it. How much volume does a man pick up? Remember, when you ejaculate, you also suck back in. But how much does he pick up from her versus how much does he deposit in her? He puts a lot more semen in her than he picks up from her vaginal secretions. And remember, if he's circumcised, doesn't have Langerhans cells. She does around her cervix. So women are 35 times more likely to get this than men are. So it's much more dangerous for women. And then the last one, and that's a good one to end on, is oral sex. It's hilarious. Mr. Clinton did a terrible thing with this country. I went to talk to my nephews, remember I have 7 nephews, about HIV/AIDS and are they using condoms and all of this. And they said, yeah, we know about all that. And I said, so are you guys having sex? No. I said, what? No, we're not having sex. I said, you're 28, 27, 24, 18, 16, and none of you are having sex. And they said, no, we're not having sex. I said, is that what you tell your mother, or is that what you're telling me? And they said, that's what we tell our mother. I said, okay, what are you telling me? He says, yeah, we have sex. I said, are you using a condom? Yeah, when we have that kind of sex. I said, what do you mean? He says, well, oral sex isn't sex. Remember, Clinton said oral sex isn't sex? Oral sex is sex, folks. When a mouth comes in contact with the genitalia, it's sex. And a lot of kids think that if they just have oral sex, it's not sex. But remember, you can get this. And you can get it, and it's a relationship to the viral load. Remember, if the person has no viral load, there's no chance. If the person's uninfected, there's no chance. But what if they have a slight viral load? Remember, everybody's got bleeding gums, they bit the inside of their cheek, or they have a tooth extraction or something like that. And in every case that we have found an oral transmission, it is involved bleeding gums, a tooth extraction, or they've bitten the inside of their cheek, and then they've received either vaginal secretions or semen in their mouth from someone that had a high viral load. So the risk is very low. It can be from 2 to 13%. And we're talking about with someone with a viral load. It can be from 2 to 13%, depending on the amount of holes in someone's epithelial and the viral load. And the last thing is, people get infected by getting blood or semen in their eyes. Remember, your eyes, you can see the blood vessels. And at the first time we found this was at Martin Luther King Hospital. A nurse in the emergency room had been taking blood, and one of the vacutainers didn't seep all the way down, and she was trying to force the little rubber stopper to seep down more, and exploded in her face, and she was infected. And so then we started researching, and we found men with high viral load, if anyone that gets semen with high viral load or a vaginal secretions with high viral load in their eye, and don't think it can't happen, can get HIV, and it does happen. So we'll start here next time. With pregnancy, a disease. Pregnancy. Would you hit that red button back there on the turn? How long someone's been positive by what bands they have. If they have a glycoprotein bands, it's only been a few weeks that they've been positive. Now, what happens next? Here's the virus setting in your blood and your body is attacking it. Most people think the body's not doing anything. It's constantly attacking it with everything it has. And so first it makes antibodies against the outer envelope, and then it rips it open, and the next thing that's seen is the core. The protein around the genome is called the core. So the second set of antibodies that are made are against the core protein, and then it makes it against the other proteins. So first is the blue, then comes the yellow, then comes the orange, and finally the last is going to be the green. So your body makes antibodies to each one of the proteins, and which antibodies it makes tells you how long the person's been infected. Now, there was one problem. I don't know if you remember, but a few years ago when they first came out with a test, they made it mandatory for people in the military. Everybody in the military has to be tested every 6 months for HIV. It's not because they want to control HIV in the military. It's because they wanted hundreds of thousands of tests to see how well it worked on the general population. Now, the detergent explodes HIV into the individual proteins, but you can't see anything. Then we put it on a charge overnight. Put a positive up here and a negative up here, and put it on a rocker overnight. The proteins of the virus line up. The lighter ones move toward the positive end, and the heavy ones stay. Actually, it's the opposite. The heavy ones stay here, and the lighter ones migrate. All right, and so they line up on a strip of paper according to their molecular weight. The next day, we add patient serum. What do you think else? Horseradish peroxidase. And if you have antibodies to any of the proteins of HIV, a black line will show up. So we are checking to see if you have, these are the proteins that make up the virus. And the P stands for protein molecular weight, 24,000 molecular weight units. And GP stands for glycoprotein or envelope protein. And so when your body comes across the virus, the first thing it sees is the envelope. So that's the first antibodies that are made. They're in light blue. So you can tell how that are seroconverting over a 90-day period to being positive, or is there something else involved? And so when they run the ELISA test, they run it, and if you're positive, you go to the next test. If you're borderline, you go to the next test. So what's the next test? Another ELISA. So they do another ELISA. If it's positive, you go to the third test. If it's borderline, you go to the third test. If it's negative, you don't go any further. So if it's negative on the first test, that's it. If it's negative on the second test, that's it. But if it's borderline, then you go to the third test. So if anybody is positive, they will have had 2 ELISAs. And those ELISAs will either be positive or borderline. All right, what's the next test? It's called Western blot. And Jane Getchell is the one that devised it. And it is basically an ELISA on a strip of paper. We take the virus and we put it in a little container, a plastic container, like this, and we float inside a strip of white paper. And we put saline in there, and we put whole HIV that we've harvested and grown, and then we put detergent. All right, so anyway, why do I want you to at least be able to recognize the numbers? You don't need to know what the name of the gene is or what it does, but you do need to recognize which numbers are in here. If I say 13, you've got to know that it's not got a 13. So it's 15, 14, 15, 17, 18, 19, 24, 25, 27, 31, 41, 51, 55, 66, 110, 120, and 160. Why? Because when you go and get a HIV test, they're going to run an ELISA on you, whether it's an ELISA on a stick, like the one where you have the little lollipop, or whether it's not now one where they take blood. But they're going to run an ELISA on you. And remember, there is no test that is 100% perfect. So there is, if this is the ELISA test, and this is so if this is the borderline that separates positives from negatives, what do you do with the top 10% of the positives? Are they people that are in what they call the windlation? And you sign away your rights when you become in the Army. You have no rights, so they can order you to do anything. So what they discovered after testing hundreds of thousands of people was that there was a Asian flu that had a P18 or a P24, and some women that are pregnant have a P55. How did they discover that? Because after they tested everybody in the military the first year, they had a bunch of Top Gun pilots in San Diego for the Navy. 17 had borderline ELISAs twice and a P18. And there was no way. They went down and investigated. They weren't shooting up. They weren't out hoochie-cooching around or anything. They were married men, and there was no way. Their wives were not positive. There was no way they could have gotten HIV. So whenever you don't have anything you can explain, what do you do in your computer when you can't get anything to work? What's the #1 rule? You should know. Reboot. That's right. And that's exactly what they did. They left them alone for 3 months and went back, and the band disappeared. So then they went into their medical records and found every one of them had the Asian flu. Then they went and got the Asian flu and found it had a P18 or P20.